So, what do you have a theory about why African Americans would have less impact if they had? If I understood you correctly, your data right now suggests that African Americans who have similar pathology are more likely to express Alzheimer's, dementia, than Caucasians. However, if they have vascular issues, they're less likely. The first finding is sort of consistent with, as you say, population studies, so not such a surprise maybe. But the other, why the second?
We don't know. The population studies also propose, because they don't have the autopsy proof, that African Americans, they are more likely to express dementia, because probably they have vascular disease together with Alzheimer's disease, because many people have, and then it lowers the threshold. But we are being able to analyze people who only have vascular components and people who only have Alzheimer component, and it seems that if you isolate only Alzheimer, the African Americans, they have a lower threshold. We don't know why yet. But it was really surprising that African American will be more protected against the expression of vascular changes. We know that in general, Africans, they have more vascular lesions in the body. They have more atherosclerosis, high blood pressure. It's really worse for African Americans. This is a finding we find in autopsies. It doesn't really impact in the clinical part, even for high blood pressure. This we know about it. So maybe for the brain is the same thing. You may say in terms of evolution, maybe the only one who survive are those who can cope better with the vascular problems they are prone to have. We don't know yet. This is a observational conclusion. And now we have to finish to analyze these 500 cases and see if it's really true. So we need a bigger data. And then propose hypotheses for this, and then tackle into this hypothesis. But so far, we even didn't know about it. And I think this is a way, in my opinion, I think it's very bad, that research should go. We have to start from the beginning, and then after we have the first findings, we will design hypotheses, and we will have to try to prove if these hypotheses are correct or not. The same for the amyloid hypothesis, which was in fashion for so many years. It seems that nowadays that's not as important as we thought it would be in the 90s. And we know it because they have been tested extensively. We know everything about amyloid. We have no drug for Alzheimer's disease so far. It's sad to think something like this, but it has to be tested. I mean, it was not a waste of time, nothing like this. And people now many labs are trying to test other kind of hypotheses. In the grant call you get every year, I think if you make a survey on this, you will see that proposals related to amyloid were much more prevalent in the past than is this year. I know I received these grants to review every year. Of course, I'm biased because I only know about the grants I received to review, but there are many different hypotheses every year, and it's more, the grant is more like not if the hypothesis is good or not, but if the person is proposing a good way to test it, because in a way it would be worth trying all of them.
Sure.
It's just that we want that good people in good environment with good approaches will test, because otherwise it's useless.
It's a great point, and hard, I think, for donors, that testing a hypothesis that proves the hypothesis wrong is valuable.
Yes.
Yeah.
It is. Because it's like this, if we are looking for depression, Prozac is the best seller drug in the US. I think billions of dollars per year are used for this kind of drugs. Prozac and its friends, all this family. But maybe we are giving this drug for some people who will have no benefit or very small benefit of it. And it causes side effects, not only the economical side effects, but everybody knows all the digestive problems, and the person can't sleep, and appetite, and so on. Especially when we are talking about elderly, they take other trend drugs and have other 10 side effects. So you have to be careful about it. And only this kind of studies that can give good evidence and that cannot be contested, because epidemiological study you always can contest. You can say it was not pathologically proved, you can say everything. But pathological proof studies, they are more difficult to contest. They are easy to be done once you have the material, and when we have the first evidence, they can be reproducible in other centers, like it's being done at Rush University right now. So it's then we can have more useful information, less contestable information. It's not useful, less contestable information.
Great. I have some questions about. So here's our issues. We need to be out of this room in a few minutes because the yoga class is here at noon, and we want to honor that. But Elizabeth and I are going to take Lea to lunch. If anyone would like to join us, you're welcome. I was thinking maybe we just go to the little Italian place on the mall, on the strip mall. I mean,
that's fine.
It's close, is all.
Yeah, it's fine.
But if anyone would like to join, I'm curious about. So when you say Africans, and then you sometimes say African Americans, and I was thinking about, I don't know if you know Hugh Hendry, who's at the University of Indiana, and he's part of he's been out and talked to us about a study that he's doing comparing a group of Africans in Africa and a group of African Americans in Indianapolis.
Yeah, it's a wonderful
It's
study.
a good study.
Yeah.
Yes.
And now but genetically would they be the same?
Of this, well, I think.
Would you guess they would be the same?
I think mostly he's dealing with Nigerians.
Yeah, that's
Yeah,
nice.
which we don't have in Brazil. We are talking about other African groups. This is the importance of being able to distinguish between them, but they exist here in the U.S., of course. And most of it is not only the U.S., they exist in Africa and other places, so it can be, it has to be tested with the Nigerians. We believe that it's true that some African groups, they are more different between each other, that they are different from Caucasians, because in many African countries there were a very big Arab invasion many centuries ago, and although these people look black, they have this Arab component in their genetic pattern. And some groups were not exposed, especially inside in the heart of the continent. They were not exposed to these waves of Arab invasions, mostly on the coast. So we have to pay attention to this. It's not, the color is nothing.
Yeah,
This is almost useless. Now in Brazil, if you are African, there is a quote to go to public university. It's very useful. So you need, so now everybody is African. Really, if you ask the person which ethnicity are you, the person can be very white, and they will say African, and maybe they can prove that a grandfather or great grandfather was African. So now it's fashionable to be African there. So it varies. At the time it was horrible, it depends.
Yeah. Well, thank you. We'll talk more at lunch.
Thank you.